Hi, my name is Noah Hayden, and today I'll be discussing bypassing the heart. In 2018, according to data collected by the Cleveland Clinic, over 500,000 open heart surgeries were performed in the United States of America. Since the 1960s, hundreds and thousands of individuals have undergone open heart surgery, though few of them know what this actually means. What does it mean when the surgeon says he will place you on pump? What does it mean to have your heart bypassed? These questions are easily answered once we understand the process of cannulation of the heart. In an article on Cardiothoracic Surgery Network, Young and colleagues describe techniques for central cannulation. During this, the surgeon will place cannulas directly into the heart that allow for connection to the cardiopulmonary bypass machine. The first step of this is cannulation of the aorta. For this, the surgeon will select a soft portion of the aorta to place a purse string suture and then secure it with a tourniquet. After the tourniquet is secured, the surgeon will puncture the aorta with a blade and place the cannula. The cannula will then be secured with the tourniquet and connected to the cardiopulmonary circuit. Young and colleagues next describe cannulating the right atrium. For this, the surgeon will place a full-thickness purse string suture into the apex of the right atrial appendage. Once this is secured with a tourniquet, the surgeon will cut or puncture the right atrial appendage and insert a dual-stage venous cannula. The cannula will be inserted into the right atrium and into the inferior vena cava. A portion of this cannula will be left in front of the superior vena cava, allowing for drainage from both the lower portion and the upper portion of the body. Once both venous and aortic cannulas are connected to the cardiopulmonary circuit, the surgeon can place retrograde and antegrade cannulas. The retrograde cannula is placed on the posterior portion of the right ventricle. A purse string suture is placed and secured with a tourniquet. Once the tourniquet is secured, an 11 blade is used to puncture the right ventricle, and a long, thin hemostat is used to dilate the tissue, while a specialized retrograde cannula is inserted through the right ventricle and into the coronary sinus. The antegrade cannula is placed proximal to the aortic cannula and secured using a purse string suture and a tourniquet. This allows the surgeon to deliver cardioplegia directly to the coronary arteries. Now that all of your cannulas are in place, what happens next? Next, the surgeon will attach the patient to the circuit or put the patient on pump. Young and colleagues describe the circuit as a connection between the heart and the cardiopulmonary bypass machine, often referred to as the heart-lung machine. The heart-lung machine has two purposes. The first purpose is to remove blood from the body, remove waste from the blood, and reoxygenate the blood before returning the blood to the body to perfuse the tissue. The heart-lung machine's second function is to provide cardioplegia to the heart. Surgeon and professor Dr. Qi Zhao describes cardioplegia as a crystalloids-based solution or a blood-based solution that contains a variety of chemicals that allow for rest of the heart and provide cardioprotective functions. Once the heart is stopped and the surgeon performs his operation, the surgeon must safely decannulate the heart. Decannulation is performed in reverse order as cannulation of the heart. For this, each cannula is removed, and as the cannula is removed, the purse string suture is cinched down and knotted into place. The final step is for the surgeon to ensure that hemostasis has occurred. Once the surgeon ensures hemostasis, the operation can conclude, and we can conclude our discussion on cannulation of the heart. As you can see, cannulation of the heart is not an impossible task, but is a task that requires years of training and specialized skill. Hopefully, by better understanding cannulation of the heart, we can better help patients and family members understand the process and help them ease their minds in these stressful times. Thank you.